So welcome back. Now, just like Hippocrates is known as the father of Western medicine, the Canadian physician, Dr. Osler, is known as the father of modern medicine. And in the late 1800s, while he is working at Johns Hopkins in Baltimore, he comes up with a few ideas to improve medical training. Specifically, that he has the medical students do book learning for the first couple of years, but then the next couple of years, they have to do book learning as well as some practical learning. So they get to go to clinics, they get to go to hospitals, they watch other doctors work, and they learn from them. And then after they graduate from medical school, they actually go into training programs called residencies, where they have some hands-on experience, but under very strict supervision. And he does this because he wants these doctors to be better at a clinical diagnosis once they get out. A clinical diagnosis means listening to what the patient has to say and matching it up with what you can see on their bodies. And in his case, he is really focused on diseases that look the same on the outside or pretty close, but are very different on the inside. And this leads us to today's topic, which is pseudogout. Now, pseudogout on the outside, like the name suggests, can look a lot like gout, but on the inside, it's actually a different crystal. It's the calcium pyrophosphate crystal, or CPP for short. And these CPP crystals can be in different joints, and they don't cause disease all the time. Sometimes they're just sitting there. But when the body reacts to it, then it is called calcium pyrophosphate deposition disease, and it can give pseudogout flares, or CPPD for short. And fun fact, it's actually Dr. McCarty, the same guy who injected his knee with the gout crystals, that identified this one in 1962. The symptoms of pseudogout, just like gout, are a little bit, but still a little bit different. It's a little bit less severe, a little bit less painful. It takes a little bit more time to peak, a little bit more time to go away. So it's kind of like a 1 week, 2 week type of disease. And it can hit different joints. So it will hit more the ankles and the knees and the wrists and the shoulders. And it's just not as common as gout is. As far as the risk factors for pseudogout, rarely it can be due to genetics, like it can run in families, or it can be due to some types of diseases that cause calcium and phosphate imbalance inside the body. But a lot of times it's due to dehydration or just chronic damage to the joint, like repetitive damage to the joint. And it's very common in women that are above the age of 70. As far as the diagnosis of pseudogout, a lot of it is actually just talking to the patient and trying to make sure that they don't have another disease that looks like it, specifically comparing it to gout. So in gout, there's a very hot, red, painful joint, as we learned. It usually shows up in the first toe, and it is more common in men above the age of 40. And it can become more chronic over time. Now compare that to pseudogout. Pseudogout tends to happen more in women above the age of 70. It's a little bit less painful. It's still red. It's still swollen. It can take about 4 or 5 days to start up, and then maybe another 4 or 5 days to calm back down. It affects different joints like the knees and the ankles and the shoulder, etc. Sometimes a needle can be put into the joint and fluid can be taken out and looked at underneath the microscope, and you can see these different crystals. And sometimes scans like x-rays, etc., can be taken as well. However, you have to be careful because, again, sometimes these crystals are just sitting there and they're not really causing the disease. As far as the treatment of pseudogout goes, first of all, correcting any calcium or phosphate imbalances if they're present, if it's happening over and over again, being hydrated, drinking lots of water. And number 3 is trying to avoid that repetitive joint trauma. But a lot of times it's a matter of taking medications like ibuprofen and Tylenol and sometimes steroids to calm the flare down. And sometimes a needle can be put in the joint, and some steroids can be injected directly into the joint to calm it down, or fluid can be taken off to kind of relieve the swelling. As far as the prognosis of pseudogout, it's actually pretty good because it's one of those diseases that is just not that common, and it is less painful, so it's easier to treat, and it usually doesn't turn into a chronic disease for the patient. And the best part is the way to diagnose this disease, if you can diagnose it correctly, you can treat it properly. And the best way to get there is by talking to the patient. As Dr. Osler would say, listen to the patient. He's telling you the diagnosis. Until next time.